from Ayushman Bharat, Dr. Akshat Mandloi, Team Lead, Project Management Unit, State Health Authority, ABDM Bhopal.
So, very good afternoon to all of you. I'm Akshat Mandloi and I'm here to talk about some, very important initiative taken by Government of India. So, since the conference is like all about future of digital revolution, and we are talking about so many new technologies, we are talking about so many new innovations, I specifically came here to talk about three major problems. Now, if industry can intervene and come up with certain solution to those problems, it will be a major push to adoption of Ayushman Bharat digital mission. So basically, since we have already rolled out this mission, and since we have already started reaching out to the last mile, last beneficiaries, we are trying to convert people to go digitize with their patient IDs, go digitize with their hospital digital IDs, and we are asking all the doctors and health professionals to come on board with this unique ID which we know as health professional registry. We have three major problems, and if the industry, since we are talking about digital revolution, if we can come up with some solution for these three problems. Now, problem number one, we want to create a digital ecosystem where the entire health data will be onboarded. The transition related to all the medical records can be dealt with, and also we wanted to have a health ecosystem. Since in the previous session we were talking about certain nitty-gritties related to the data protection policy. So, can we create an ecosystem now? We don't work into these silos where the government is working only for the government institutions. We are working with private institutions as well, and we would like to create an ecosystem which works on both the sides. I do have private hospitals working with us. I have my government institutions as well. So can we come across a digital ecosystem which is in a symbiotic relationship between all the private and public institutions, where my patient can walk into any of the health institutions and can avail the services of all the digital records related to their medical history, health history, and at the same time I have a smooth transition along with the data protection policy. So this is challenge number one. Although we have reached somewhere nearby visualizing an ecosystem where we have the registries, we are trying to digitize all those records, all those unique identities of our patients, hospitals and professionals. But still there is a lag that we are still not able to achieve that entire ecosystem which work in a very symbiotic relationship between all the private and public institutions. Problem number two. Now, despite having an ecosystem in place, can I ask all the doctors, hospitals, and also specifically to my beneficiaries or the patients to come on board and start using that ecosystem? If I'm not wrong, we have seen a digital revolution in terms of payments. We have seen it in the finance sector. But still there was a lot of resistance faced by many of the banks and even the private institutions if they wanted to go for digital payments. There was a lot of resistance and a lot of IEC required, a lot of awareness required to make people use those financial instruments to make those transitions to the bank, to the vendor directly. Despite having an ecosystem available in place to making those transitions, it was really difficult to make a change or to revolutionize this financial transitions. So can we replicate the same story in the healthcare sector as well? And problem number three, which is very unique in nature, and I believe this is the problem majorly we face in the healthcare system itself. Basically, I cannot push my doctors specifically to use digital records, or I cannot ask them to go away with their paper-based approach in writing the prescriptions on the paper. because they have a very unique method. So interestingly, I came across certain studies or some research paper which says that why there is a lot of behavioral change required for pushing the doctors to start using the digital record is because while they write it on the prescription at that time only they make the decision that I want to prescribe this particular drug to this patient. So it's a very unique kind of a challenge, but since we are talking about digital revolutions, I am very sure that the industry is having certain solution to these problems as well. So let's talk about the mission. I know it's late afternoon and people are looking for get away with this session. So I'll make it very quick. I'll just talk about very specific pointers. So as you see on the slide, we are working with a digital mission. The mission is nothing but try to create more and more registries. Can you move on to the next slide, please? Yes, so basically we want to digitize the entire healthcare ecosystem. Major use of digitizing the entire ecosystem is to gather as much data as possible so that policy level decisions would be a lot more easier. We have seen this drastic utilization of the data in terms of the COVID pandemic, where I had the information about who to be vaccinated, who all got vaccinated, and when we need to finish this vaccination drive so that I can say that my community is safe and secure. So that policy level decisions can be made only if we have the data in hand. So if we digitize the entire ecosystem, it will be a lot more easier for the policymakers. Basically, I just have three important aspects. So whenever I talk about healthcare digital mission, there are three stakeholders specifically. Number one, my citizens. So Ayushman Bharat digital ID for individuals, it's beyond caste, community, creed, color, and even beyond the economic criteria also. It is not only for the below poverty line, even every single citizen of India is entitled to create their Aadhaar ID, and that Aadhaar ID will be utilized to make all the medical transactions across all the facilities, be it public or private. If I talk about the second identity, I cannot do it until unless my doctors, my healthcare professionals do not assist in this entire drive. So we need to create a unique ID for our doctors, to our all the healthcare professionals, be it nurses, be it pharmacists, or be it even the lab technicians and others. So we are trying to create the IDs for them as well. And the third is, of course, how we are going to manage the entire drive. So at the level of policy making, decision making, and also at the level of managing the entire drive, we need some data in hand, and that is why we are creating that ecosystem where we are pushing everybody to go digitize. In that case, it will help my policy makers to have certain data in their hand so that they can make the decisions. The construct is very simple, it's not very difficult to understand. There is simple registry based or database which is available, which is having a unique ID for all the individuals, unique ID for all the hospitals, unique ID for all the doctors, and at the same time there is a lot of data flowing in terms of your health record. So if I may ask, many of us are aware about their COVID vaccine certificate. What if I want to utilize the same data for some other healthcare drive? Let's say tomorrow I want to vaccinate people, those who are already vaccinated through COVID vaccination drive. So if I have the data flowing somewhere on the crowd through that previous vaccination drive, I can utilize that data. That can only happen if we have the digital data in hand, and hence we have the Ayushman Bharat digital. So mission and mission we have already talked about. These are the major components which we are currently working on. Specifically, if I talk about the Aadhaar card is nothing but a unique identity for each of my citizens. Each of the patient is having a unique Aadhaar card, and this Aadhaar card is nothing but an KYC done through the Aadhaar database, which is already existing. So what we are doing is very simple. We fetch the data from the Aadhaar database and create an Aadhaar ID. So I request that we have already created an Aadhaar kiosk in the conference premises itself. So if you want to create your Aadhaar ID, please do create your Aadhaar IDs, because it is for all the citizens of India. The second identity is nothing but the professional healthcare registry. So all the healthcare professionals should have this unique ID. If you have this unique ID, you will be able to take the details of the patient through a consent layer. As Sir was specifically mentioning about the data security, we have tried to keep all the aspects of the data security, and specifically through the national data protection policy, all the nitty-gritties has been taken care of, and we have created a unique layer through which if the patient wants to share his data to any specific doctor, it has to go through a consent form. Apart from that, we have created the facility registry. Now, this is something unique because I need to have data somewhere in the cloud, somewhere in my ecosystem, which can tell me that how many healthcare facilities I have and where these facilities are located, so that I can make a decision that if tomorrow I want to vaccinate my entire population, these are the vaccination centers. So that is why healthcare professional registry is very unique and very important. Now, let me talk about some unique facilities which Ayushman Bharat Digital Mission has to offer to the citizens of India. We have talked about unique IDs. We have talked about how the hospital will get digitized, how the patients will get digitized, and how the doctors will get digitized. But what will be the end benefit to the citizen? So in that particular case, there is a very simple definition that if I make an appointment with a doctor and there is one single episode where I discuss with my doctor and a prescription is generated, it is called an electronic medical record. It's a single episode, the interaction between doctor and patient. Now, if I continue to visit multiple episodes I am having with my doctor and there is a detailed record being generated, it is known as electronic health record, or also known as EHR. Now, the ownership lies with the institution. If I change the ownership criteria from the hospital or the institution to an individual, so let's say you are the owner of your health record, it becomes personal health record, and it is a very unique benefit which you are offering to our citizens, that you are the owner of your health data. Whatever is related to your health, whether you have been vaccinated, whether you have taken any sort of medication, any prescription in the past, you are the owner of your health data. So this is the unique benefit which you are offering. Let me just quickly conclude my session by telling that these are the unique benefits which you are offering to all our stakeholders. I would request that if you have certain solutions to our problems, certain in fact, I would request that if there are any technology platforms which are already available, which has been already dealt into some other industries, if we can replicate the same success story in the healthcare sector, it will be really helpful. So I just conclude myself by showcasing certain important numbers. In Madhya Pradesh, we have created 6 microsites where we are progressively digitizing the healthcare facilities. So these are the 6 microsites, and these are the unique number which we have already achieved through our drive. And we would request that if you can help us assisting in creating or achieving the targets as quickly as possible, it will be really helpful. Thank you so much. And yes, if you have any questions related to ABA, HFR or HPR, please